Right. I need to talk to you about something that might save your life. And I'm being completely serious here. After more than 20 years working as a physician, I've seen firsthand how sexual health in older age isn't just about pleasure, it's about survival. I'm Dr. Emily Harrington, and today we're going to discuss why masturbation in later life is backed by solid science as a genuine health intervention. If you're over 60, this could be the most important conversation you have this year. Now, I know what some of you might be thinking. You've reached a certain age, and perhaps you feel that sex is something you needn't bother with anymore. Many of my patients over the years have told me they thought sexual desire simply disappears with age, or worse, that it's somehow inappropriate for older people to have any interest in sex at all. But here's the truth, and I've got decades of medical evidence to back this up. That's complete rubbish. Your sexual health matters just as much at 70 as it did at 30, perhaps even more so. Let me start by addressing something rather important. In British society, and particularly amongst older generations, there's been this terrible taboo around discussing sex openly. I've had countless patients sit in my surgery, clearly uncomfortable, unable to articulate concerns about their sexual health because they've been taught it's something shameful or private. But think about it. We happily discuss our dodgy knees, our blood pressure, even our bowel movements with our GPs. Yet when it comes to sexual function, suddenly everyone clams up. This needs to change, because what I'm going to share with you today could genuinely improve your quality of life and, quite possibly, extend it. The science behind this is absolutely fascinating. When you engage in sexual activity, including masturbation, your body undergoes a remarkable series of physiological changes. I'm talking about real, measurable effects that we can observe and document. First off, there's the stress relief. Now, I don't mean just feeling a bit more relaxed afterwards. I mean actual biochemical changes in your brain. During sexual arousal and orgasm, your brain releases endorphins and oxytocin, what we sometimes call the happiness hormones. These chemicals are proper stress busters. They lower cortisol levels, help you feel calmer, and can even improve your mood for days afterwards. For older men in particular, this is brilliant because many of you are dealing with chronic stress. Whether it's worrying about health, finances, or perhaps loneliness after losing a partner, that constant stress takes a real toll on your body. It affects your heart, your immune system, even your cognitive function. Regular sexual activity, including masturbation, provides a natural, safe way to combat that stress without needing medication. But it doesn't stop there. The cardiovascular benefits are remarkable. When you're sexually aroused, your heart rate increases, blood vessels dilate, and circulation improves throughout your entire body. This is essentially a gentle workout for your cardiovascular system. Studies have shown that men who maintain regular sexual activity, including masturbation, have lower rates of heart disease and hypertension compared to those who don't. I'm not suggesting it replaces your morning walk or a proper exercise routine, but it's certainly a beneficial addition. Let me tell you about one of my patients. We'll call him George. George came to see me about 5 years ago. He was 72 at the time, concerned about his blood pressure. During our conversation, it emerged that he'd completely given up on sexual activity after his wife passed away 3 years earlier. He simply assumed that chapter of his life was over. I encouraged him to reconsider, not just for pleasure, but as part of a holistic approach to his health. 6 months later, George's blood pressure had improved noticeably. Was it solely down to masturbation? No, he'd made other lifestyle changes too, but he told me himself that he felt more energized, slept better, and generally felt more like his old self. Now, let's talk about hormones, because this is where it gets really interesting for older men. As you age, your testosterone levels naturally decline. This is just part of getting older, but it can lead to all sorts of issues: reduced energy, mood changes, decreased muscle mass, and yes, reduced sexual desire. Here's the thing though, sexual activity, including masturbation, can help maintain healthier hormone levels. It's a bit of a positive feedback loop. Engaging in sexual activity stimulates hormone production, which in turn supports your overall health and well-being. For many older men, there's also the prostate to consider. Regular ejaculation, whether through sex or masturbation, may help maintain prostate health. Some research suggests it could even reduce the risk of prostate cancer, though I should say the evidence isn't conclusive yet. What we do know for certain is that maintaining sexual function helps keep everything in working order down there, which is never a bad thing. The mental health benefits are equally important, if not more so. Loneliness and isolation are massive problems for older people in this country. After retirement, after losing friends or a partner, many older men find themselves quite socially isolated. Depression and anxiety rates amongst older adults are worryingly high. Maintaining a healthy relationship with your own sexuality, including regular masturbation, can significantly boost your mental well-being. It's about self-care, really. It's taking time for yourself, acknowledging your own needs and desires, and doing something that makes you feel good. I've also seen how it can help with sleep. Many older men struggle with insomnia or poor quality sleep. The relaxation that follows orgasm can be a natural sleep aid, that post-orgasm feeling of contentment and tiredness. That's your body's way of saying it's time to rest. If you're lying awake at 3 a.m, worrying about this and that, masturbation might just help you drift off. Right. Now let me give you some practical advice, because I know some of you might be thinking, well, that's all very well, Emily, but how exactly should I go about this? Listen to your body. That's the first rule. You're not 20 anymore, and that's perfectly fine. Don't feel you need to perform or achieve anything particular. If you're feeling up for it, brilliant. If not, that's also fine. There's no schedule you need to stick to. Some men find once or twice a week works well for them. Others might prefer more or less frequent activity. The key is what feels right for you. Create a comfortable environment. Privacy is important, obviously, but beyond that, think about what makes you feel relaxed. Perhaps it's a particular time of day when you know you won't be disturbed. Some men find mornings work well, as testosterone levels tend to be higher then. Others prefer evening, as it helps them wind down before sleep. There's no right or wrong answer here. If you're experiencing physical difficulties, erectile dysfunction for instance, don't just soldier on in silence. This is exactly the sort of thing you should discuss with your GP. There are treatments available, from medication to other interventions, and there's absolutely no shame in seeking help. I've prescribed Viagra and similar medications to countless patients over the years, and for many it's made a tremendous difference to their quality of life. Use lubricant if you need it. As we age, our skin becomes thinner and more delicate. There's no point making yourself uncomfortable or risking injury. A good water-based lubricant is perfectly safe and can make the experience much more pleasant. You can pick these up at any chemist, and there's no need to feel embarrassed about it. Now, I want to address some specific questions that I'm often asked, because I think many of you might have similar concerns. One gentleman asked me recently, I haven't ejaculated in 5 years, and when I last did, there was no smell to the semen. Is that normal? Right, so this can happen for several reasons. As men age, the composition of semen changes. The volume might decrease, the consistency might alter, and yes, the smell can become less noticeable. However, if you're concerned, especially if you've noticed other changes like pain or blood, you should absolutely see your GP or a urologist. They can check for any underlying issues. Another common concern is erectile difficulty. I can't get or maintain an erection like I used to. This is incredibly common, and you're certainly not alone. Age affects erectile function for most men. Blood flow changes, hormone levels shift, and sometimes medications you're taking for other conditions can have side effects. But here's the important bit. Erectile dysfunction is often treatable. Sometimes it's as simple as adjusting medications or addressing lifestyle factors like smoking or weight. Other times, medication like sildenafil can help. The crucial thing is to speak to a doctor about it rather than just accepting it as inevitable. Several people have asked me, which doctor should I see about sexual health concerns? Your GP is the best starting point. They can assess your overall health, discuss any concerns, and refer you to a specialist if needed. That might be a urologist who specializes in male reproductive and urinary health, or potentially an endocrinologist if there are hormonal concerns. Don't feel you need to figure this out alone. That's what we're here for. I've also been asked about frequency. How often is too often or not often enough? Honestly, there's no magic number. Sexual health is incredibly individual. What matters is what feels right for you and doesn't interfere with your daily life or cause you distress. If you're enjoying regular sexual activity, whether with a partner or alone, and it's not causing problems, then you're doing fine. If you've noticed a significant change in your desire or ability, that might be worth discussing with a doctor, as it could indicate an underlying health issue. Here's something else I want to address: the role of exercise and general health. Maintaining your sexual health isn't just about the act itself. Regular physical activity, proper sleep, and a healthy diet all contribute to better sexual function. Walking, swimming, or even gardening can improve your cardiovascular health, which directly benefits erectile function. Eating well helps maintain healthy hormone levels and energy. And good sleep. Well, that affects everything, including libido. For those of you who've lost a partner, I know this can be particularly difficult. One patient told me, "Since my wife died, I've lost all interest. I feel guilty even thinking about it." This is a completely natural reaction, and grief affects everyone differently. But I want you to understand that maintaining your own sexual health isn't a betrayal of your late partner's memory. It's self-care. It's about looking after your physical and mental health. Many widowers eventually find that reconnecting with their sexuality is part of the healing process. I should also mention that whilst I'm focusing primarily on masturbation here, these benefits extend to partnered sexual activity as well. If you're in a relationship, maintaining sexual intimacy with your partner can strengthen your emotional bond, provide those same health benefits, and add real quality to your later years together. Communication with your partner about sexual needs and concerns is vital. Many couples find that sex in later life can actually be more satisfying than when they were younger, once they've moved past any initial awkwardness or physical adjustments. Let me share another example. I had a patient, let's call him Robert, who was 68 when he first came to see me with concerns about depression. He'd retired 2 years earlier and was really struggling with the transition. No purpose, he felt, nothing to get up for. During our conversations, it became clear he'd also completely neglected his sexual health. He'd assumed that part of his life was over. We worked on several aspects of his well-being, including encouraging him to maintain sexual activity. He was skeptical at first, thought it wouldn't make a difference. But 6 months down the line, he reported feeling significantly better. Not cured of depression, mind you. It's not a miracle solution, but definitely improved mood, better sleep, and generally more engaged with life. Now, I want to be clear about when you should seek medical help. If you experience pain during sexual activity or masturbation, that's a red flag. Pain isn't normal and could indicate an infection, inflammation, or other medical issue. Similarly, if you notice blood in your semen or urine, see a doctor promptly. If you're having persistent erectile difficulties that are new or worsening, that's worth investigating. And if you're feeling depressed or anxious about sexual health issues, please talk to someone. Your mental health matters just as much as your physical health. There are also some practical safety considerations. If you have cardiovascular issues, it's worth discussing sexual activity with your doctor. The physical exertion involved is generally quite modest, similar to climbing 2 flights of stairs, but if you have significant heart disease, it's worth getting personalized advice. Similarly, if you're on medications like nitrates for angina, you need to know that they can interact dangerously with erectile dysfunction medications. Always tell your doctor about all medications you're taking. I want to circle back to something really important: the taboo surrounding sex and aging. Throughout my career, I've watched this slowly begin to shift, but we've still got a long way to go. Older people are sexual beings. That doesn't stop at 60 or 70 or 80. Your needs, desires, and capacity for pleasure don't simply disappear because you've got grey hair or need reading glasses. The sooner we all accept this as a society, the better off older adults will be. Think about it this way: we readily accept that older people should maintain their physical fitness, eat well, stay mentally active, maintain social connections. All of these are recognized as important components of healthy aging. Why should sexual health be any different? It's all connected. Your sexual health is part of your overall well-being, and neglecting it can have real consequences for your quality of life. I've seen too many older men suffer in silence with sexual health issues because they're too embarrassed to bring it up. Gentlemen, there is nothing embarrassing about wanting to maintain your sexual health. It's as normal and healthy as wanting to maintain your mobility or your cognitive function. Any good doctor will take your concerns seriously and work with you to find solutions. Let me also address something for those of you who might be thinking, well, I'm too old to start now. Nonsense. It's never too late to reconnect with your sexual health. I've had patients in their 80s who've successfully addressed sexual health concerns and experienced significant improvements in their quality of life. Your body is remarkably adaptable, and with proper support and perhaps some medical intervention, many men can maintain satisfying sexual function well into their later years. For those of you with chronic health conditions, diabetes, heart disease, arthritis, or whatever else you might be managing, sexual health is still important. Yes, these conditions can affect sexual function, but they don't mean you need to give up entirely. Work with your healthcare team to find solutions that take your overall health into account. Often it's just a matter of making some adjustments or trying different approaches. I also want to touch on the role of pornography and technology, because this comes up occasionally. Some older men discover online adult content for the first time and wonder whether it's helpful or harmful. My view is that if it aids sexual enjoyment and doesn't negatively impact your life or relationships, it's generally harmless. However, if you find yourself compulsively viewing pornography to the exclusion of other activities, or if it's affecting your relationships or mental health, that's worth examining. Balance and moderation, as with most things in life. Right, so to sum up what we've covered today, masturbation and sexual activity in later life offer genuine scientifically backed health benefits. We're talking about stress reduction, cardiovascular health, hormonal balance, improved sleep, better mental health, and overall quality of life. It's not frivolous or inappropriate, it's self-care. It's taking control of your health and well-being. The practical steps are straightforward. Listen to your body, create a comfortable environment. Don't be afraid to use aids like lubricant. Maintain overall physical health through exercise and diet. And most importantly, talk to your doctor if you have concerns. There's no shame in any of this. Your sexual health matters. Full stop. I encourage all of you to think about this as part of your overall approach to healthy aging. You wouldn't ignore your diet or stop exercising because you've reached a certain age. Don't ignore your sexual health either. And please, if you're struggling with anything I've discussed today, make an appointment with your GP. That's what we're here for, and I promise you, we've heard it all before. There's nothing you could tell me that would shock or embarrass me. Remember, aging doesn't mean giving up on pleasure, intimacy, or sexual satisfaction. It's just another phase of life, and with the right approach and support, it can be just as fulfilling as any other. Take care of yourselves, all of you. Your health, including your sexual health, is worth the attention and effort.